Welcome to episode 249 of the Pharmacists Voice Podcast. I'm your host, Kim Newlove. The answers to the drug disposal quiz in episode 242 of the Pharmacists Voice Podcast are the focus of today's episode, and you can find the show notes on thepharmacistsvoice.com. My audience is typically pharmacists, pharmacy students, pharmacy technicians, pharmacy professors, pharmacy owners, and medical narrators. These quiz questions, are for pharmacy professionals who field questions about drug disposal from well-meaning patients, friends, family, and community members. These questions and answers are meant to prepare you for drug disposal questions so that you can field them any time of the year. I asked 10 questions and crowdsourced the answers. In this episode, you'll hear input from a number of sources. First is a panel discussion featuring 3 women from The Ohio State University College of Pharmacy's Generation RX program, which is a medication safety-focused educational outreach program. Then I'll share responses from 2 DEA representatives. That's the Drug Enforcement Administration. One is a National Take Back Initiative coordinator, and the other is a Community Outreach and Prevention Support Program manager. I'll be summarizing their responses after the panel discussion with OSU. They were not available for podcast interviews, these DEA sources. And last but not least, I'll share input from my poison prevention educator friends, Dr. Wendy, Stephan, and Angel Bivens, RPH. And I'll also give you some input from the Poison Helpline, specifically the Central Ohio Poison Center. The Central Ohio Poison Center. That is local to me. I live in Northwest Ohio. The Central Ohio Poison Center is apparently the nearest poison center to me. Let's start with my panel discussion featuring Brittany Sandidge, Dr. Ruth Emptage, and Dr. Kelsey Schmuhl. First, Brittany, would you like to say a little bit about who you are and what you do?
Absolutely. And thank you, Kim, for having us. We're excited to be here today. So hello, everyone. My name is Brittany Sandidge. I'm the director of the Generation RX program. We are an educational outreach program of the College of Pharmacy, and our mission is really to bring resources around safe medication use to people of all ages. We work with a wide range of partners, wide range of institutions, really to get that message out and to talk about the importance of how to use medication safely in day-to-day lives. So excited to be here, excited to share more.
Thank you very much. And on to Ruth.
Sure. Hi, I'm Dr. Ruth Emptage. I am a faculty member here at the College of Pharmacy and have been involved with the Generation RX project for several years now. My area of expertise is in geriatric pharmacy, and so that's kind of what I bring to the project.
Thank you very much. And on to Kelsey.
Yes, thank you. My name is Dr. Kelsey Schmuhl, and I'm also a faculty member at the College of Pharmacy. And I've been involved with Generation RX since I was an undergraduate student. So have a long history of being with Generation RX since the beginning. And now as a faculty member, really kind of bring my perspective as a practicing pharmacist to the project. And I work with adolescent and young adult patients in my clinical practice. So it's been a fun way for me to incorporate medication safety into my clinical practice site and also get to share it with the students. So I'm really excited to be here as well. And thanks for having us.
My pleasure. Thanks again for being here. Let's dive in. I had a drug disposal quiz back in September to try to get my listeners ready for Drug Take Back Day, which is coming up on October 28th. When I release this, it will be October 28th. So hopefully people will be ready. For the first question, let's say your cousin gives you a half-empty tube of fluorouracil. That's the question. Hopefully my listeners have listened to this before. Kelsey, what's the best way to dispose of this?
So you went with me for the hard one first. So as many people may know, I would say the best answer to dispose of medication would be to go to a take back day or a permanent drop off location located at a pharmacy or at a police station or fire station. Creams, I think, can be a little tricky sometimes. Sometimes when you go to a permanent disposal location, they will only accept tablets or they will only take prescription pills or over the counter pills. Even liquid gels or gel caps sometimes they don't take. So I think if you're going going to a disposal location, it might be worth just looking at what they accept at that location. If a permanent drop-off location or a drug disposal day is not available, I would probably recommend maybe a drug disposal bag at home. You can get some of those. There's really nice single-use bags out there now that you can put tablets in. You could probably squeeze the rest of that cream in one, mix it with water. It makes it kind of a mush in there, and then you throw it in the regular trash so that no one could get into it. So those would probably be my two options, number 1 and 2, with the at-home disposal being the backup plan.
I like it. Ruth or Brittany, anything to add?
This is Ruth. Your quiz is a little tricky with the 5FU cream, I'll have to say, because you do want to be a little careful that as you're manipulating or coming into contact with that specific cream too. So I would just add that caveat to that specific cream. But besides that, I certainly echo what Kelsey said.
Thank you very much. As a reminder for the pharmacists listening to this, why would someone need to be careful with touching it?
This is Ruth again. This is a chemotherapy drug. And so, it can certainly be significantly irritating, and as well as there could be potentially some absorption. So it is one that you've got to be a little careful with.
Does anybody want to say anything about how 5FU might cause a problem with a pet?
Yeah. Hi, this is Ruth. As far as the 5FU, as it can be irritating and harmful to humans, we also have to look out for the little people or the little pets, or any pet that we also might have in our household. So this, as well as many other medications, need to be disposed of appropriately so that they don't fall into the hands of children or pets as well.
Excellent point. Thank you so much for sharing that. Let's move on to question number 2. Kelsey, you're volunteering at a movie night at your child's elementary school. You're at the sign-in table. A first grader with a peanut allergy gets dropped off with their EpiPen. You're now in charge of the EpiPen. You notice that it's expired. What do you say to the parents when they come pick up the kid and the EpiPen?
Yeah, that's a good question. And you know how easy it is sometimes when you have rescue medications at home that hopefully you never have to use. Sometimes we just kind of miss the expiration date. So I think this is a really good opportunity to just bring it up to the parent, because honestly, they probably just don't know. So at pickup, I would certainly kind of point out that it's expired. And obviously, an EpiPen is really important to have around. As a pharmacist, I wouldn't want this family to be without an EpiPen for any period of time. So while I do recommend disposing properly of expired meds, I would probably advise this family to submit for a refill when their pharmacy opened, or if they don't have a refill, call their provider to get a new prescription. And I would hold on to the expired one, honestly, until the new one is in hand. And because we know that even at 5 months expired, it would be better than having nothing in a situation where an anaphylactic reaction was happening. Once they had that new unexpired product in hand, I would similarly advise them to go to a permanent drop-off or a drug take-back day. Once again, injectables are going to be another one that you have to check to make sure that they accept. So that will be an important piece to the disposal. But usually, if you can't find the information online, calling the location and seeing if they will accept it could be an option there too.
Great answer. Thank you. This has actually happened to me, and that's why I put it in the drug disposal quiz. I had to have this tactful, kind of quiet conversation at the pickup and say, hey, listen, I noticed this is expired. I didn't go into the detail that you did about getting a new one in hand before getting rid of the other one, but I did mention it to them, and they kind of nodded their head like, I know what to do. I got it from here. But
good.
I loved your answer. Ruth, did you have anything to add? She's saying no. All right. Thank you so much. Let's move on to the third question. You're visiting grandma. You have a headache and you need some Advil. You go to her medicine cabinet. Everything's 20 years expired. Oh no. What do? How do you confront grandma? You're going to have this conversation with a headache too. What do you say to grandma, Ruth?
Yeah, this is Ruth. I'm certain that many of us have experienced something similar to this, maybe not to this extent, but it is well worth the conversation with grandma to gently approach her and say, hey, would you mind if I helped clean out your medicine cabinet? You're certainly willing to help me out too, but I really feel like these medicines are a good bit expired and not doing me any good anymore. So let's get them out of here and make room for maybe the few things that you do need. And then, of course, it would be putting these in a bag and taking them to either drug take back day or a permanent disposal box.
Would you recommend that you, as the granddaughter, take care of them for her so she doesn't, keep holding on to them when your back is turned? What do you think about that?
This is Ruth. Absolutely. If grandma's willing to let me take care of them, that it would be the best scenario for sure.
Great answer, and thank you. Kelsey, anything to add?
I would just add a plan B if grandma's not able or unwilling to go to a permanent disposal location. There are some alternative methods for disposing at home. Certainly, we have talked about the drug disposal bags if those are available. But if not, and we really had to go with an at-home method, making sure that none of the drugs that she has are on like the flush list. There are certain ones that are on the flushing list, mostly opioids or medications that can cause serious harm if they were ingested inappropriately. But other than that, if none of them are on the flush list, you could advise her or show her how to mix the medications in with something undesirable like kitty litter, coffee grounds, dirt, making them not as appealing to anyone who would be in the trash, and then throwing them away in the household trash. But certainly an alternative Ruth's option would be my number one choice.
All right. And Brittany, did you have anything to add?
Just to piggyback off of Kelsey's comment about Plan B, there are several states across the country right now that do have programs for providing at-home disposal bags that you can actually mail in and get those sent to you for free. So that's an ideal solution for adults who might have transportation concerns, or maybe they're caring for themselves, but they're not they're in a more rural location with less access to a regular Dropbox option. So I would encourage your listeners to look up and see if their state's one of them. And I certainly can provide a couple of links to direct them that way. But just knowing that that's an additional resource where they can mail in and have something provided to them is just a great tool in the toolbox.
That is a great tool. I would love to hear a little bit more about that. Maybe when we're all done with the quiz, you could give me a website and we can share that with the listeners. Let's move on to question number 4. Your domestic partner, let's say it's your husband, switches from lisinopril to losartan. He doesn't know what to do with his discontinued lisinopril. It's drug take back day coming up. What do you recommend he does?
This is Kelsey. I'll take that one. As somebody who has a husband on losartan, I'd be happy to answer this. And I don't think he'd mind me sharing that with you. He's always willing to be an example for my students. So we actually see this switch quite a bit in pharmacy, as you know, with the ACE inhibitors having kind of the additional maybe dry cough type side effect. We see some people switching over to the class of ARBs, so losartan. And I think this can be really confusing if you keep both of them in your house. So it's really important to get rid of your lisinopril so that you don't get confused, forget maybe which one that you're taking, accidentally take them both. There are many opportunities to kind of make a mistake, even if it's unintentional there. So I think it will be really important to get rid of the lisinopril. And there are many ways to do that. There are certainly, with drug take back day coming up, you could find a location to drop them off. Pills should not be a problem at any disposal location. So going to a permanent location, which there are many, you can look up online where the closest one to your house is. And we've certainly talked about the home methods as a last resort. If you're going to dispose of something like that at home, another thing I think it's important to mention is when you have kind of like that regular prescription bottle that's probably holding your lisinopril, it has a lot of your personal health information on it. So making sure you either remove and shred the label or black out with a marker like any of your personal information before throwing that in the trash will also be very important. So definitely a common situation. I would say a lot of us have either gotten switched to a similar medication for the same indication, or maybe just go up on our dose of the same medication, which can also pose an opportunity to make a mistake there. So that would be how I would do it.
Excellent answer. And would you recommend that he hold on to the pills until Drug Take Back Day? Now, pretend that Drug Take Back Day is not this Saturday. Maybe it's 5 months from today. When is the best time to get rid of something when you're already starting the new one?
As soon as possible, I would say. If you know you're picking up a new medication that's for the same thing, maybe even bring it to the pharmacy when you pick up your losartan to put it in their permanent disposal bin that's there. So I would say if a drug take back day is not occurring this Saturday, then taking it to a permanent location as soon as possible so there's lower risk for confusion will be really important.
I love that answer. Ruth, do you have anything to add to that?
I would just echo that I think people are pretty familiar with the 2 drug take back days that happen every year, but less familiar with the fact that, the permanent disposal boxes for medications are really becoming very prevalent in most people's communities. I think Kelsey already mentioned police stations and fire stations, but several pharmacies do have them too. Not all of them do, but I do think it's worth emphasizing the point that those are available really as you need them, and we should take advantage of that.
Thank you for echoing that. I completely agree. Now for the 5th question. You're a volunteer with your county's addiction task force. They have information tables at health fairs and other community events. What opportunities do pharmacists have when they're manning these tables to spread the word about Drug Take Back Day?
This is Brittany. I think there are so many opportunities. I think first and foremost, if you are in that sweet spot of a month out from a take back day, you're going to want to promote it and promote all of the locations that folks might have within your community. So maybe there's a local website, maybe there's a hotline to call, whatever it is, you're going to want to figure out that local opportunity and promote it as best you can. I think it's also, speaking from that Generation RX perspective, it's a great opportunity at one of these types of events to promote family engagement activities that really look at why is it important that we keep our medications in their original packaging, or why is it that we do regular clean outs and all of those things. And we provide some resources and some kind of quick activities for tabling events just for that purpose. So one example is a candy versus medicine game, which we really gear towards that elementary age audience. But every time I take that out in the community, it's such a great family engagement opportunity because medications and candy look so similar in today's market. And we can stump adults and children alike with that. And the real takeaway there is we need to make sure our children know who our trusted adults are and that they can know who to ask if they have a question, to reinforce that in the family setting, we keep things in those original packages or we keep them up away, stored in a locked location, right? So I think those are those extra steps you can take just beyond a little bit of information sharing. You can take it and make it engaging, make that lesson stick, and use some of those activity station ideas that we have on our website that are available for free.
Thank you. And Brittany, would you like to give the website since we're on the topic?
Absolutely. So it's generationrx.org. And what you'll find on our website, we have resources and activities that are really geared towards each stage of life. So there are activities that you can do with elementary students. Then we have activities and presentations that you can run with your teen group, your middle school and your high school groups. And that can be done in a church setting, in a school setting, and after school. I mean, there's just a wide range of places to use it. And then we have them all the way up through the lifespan, ending with that older adult population. And so it really takes into account of what do I need to learn now for the stage of life I'm in? What can my parents or caregivers then learn to reinforce in that day-to-day life, in their workplace, their home, and so on. And so generationrx.org makes it easy for you to find those things that are appropriate for the audience that you're trying to work with.
Excellent answer. Thank you so much for sharing the website and all of those great ideas. Ruth, is there anything else that you would add to that? Anything that pharmacists may have an opportunity to do when they're at a outreach event?
Yeah, I think anytime that you have the opportunity for a one-on-one conversation with someone around safe drug, in my opinion, safe storage and disposal is something that we should take advantage of. And who better to ask than your pharmacist?
Excellent. Thank you for sharing that. Kelsey, anything to add?
Nope, but if you have a student on rotation with you as a pharmacist, bring them too, because that's a great learning opportunity, and they can usually get some of their community health service hours.
Spoken like a professor. I love it. Awesome. I would definitely recommend also adding maybe the poison helpline, maybe some magnets or stickers, things like that. That's an opportunity as well. But yeah, you guys have it covered. There's a lot of opportunities to talk about Take Back Day, safe drug storage, and the poison helpline for sure. All right, let's move on to the next one. Number 6. Oh my goodness, this one really resonates with me because I've got one kid at college now. One of your kids comes home from college to visit. They have some illicit drugs in their pocket. How do you get rid of illicit drugs? Can you take them to a drug take-back event?
This is Kelsey, and usually not. Usually drug take-back events do not allow the disposal of illicit substances. So this is a hard one. You're probably going to be doing those home methods to get rid of illicit substances if you're going to be disposing at home that we've already mentioned, or checking, once again, if they're on the flush list. So many many drugs that are commonly misused now have opioids in them or contain opioids or are opioids. And most opioids you will find on the FDA flush list just because they pose such a danger if somebody were to get into them. So I would utilize the home methods. And as somebody who works with teenagers, I think knowing that we tend to see risky behaviors kind of peak during that 18 to 24-year-old range. And, this is a college is especially a time where students often will try new things, take new risks. So it's a good opportunity to talk with the youth, I think, and really implement a harm reduction approach of how am I going to keep you safe, and that's another reason to talk to your pharmacist. If you think your youth is going to be engaging in taking substances, making sure that they have those harm reduction tools like naloxone available, or talking about naloxone, or even the fentanyl testing strips that are available now for free at a lot of places. That's really the epidemic that we're seeing now is this illicitly manufactured fentanyl being mixed with things without the user's knowledge, which can be really scary, I think, for a parent to think about. So there are a lot of ways that your pharmacist can help with the harm reduction space.
Thank you for sharing that serious topic, I know. I will be talking to the DEA at some point, and I will be getting an answer for everyone about that. So stay tuned, my listeners. I will
Thank
get some sort of an answer. Let's move on to the next one. You're working in a community pharmacy. One of your patients comes in with a grocery sack just full of expired medications. She wants to just hand them over to you and have you deal with it, but you don't have a drug take-back box at your pharmacy. What do you do, Ruth?
It's going to be really tempting as a pharmacist to want to take it and to solve their problem, but it does open you up to some potential issues, especially if there are controlled substances in that bag and you're likely not going to know that. So it's going to be important to encourage them to find, and with that amount of medications, for them to resource them with the closest drug disposal location to them. Again, reiterating that it is often the police station or the fire station. That is definitely what I would do if I found myself in this situation.
I love that you addressed the fact that pharmacists love to help people, and it would be hard to turn them away because you know that you could have an impact right there. Thank you for sharing that and being honest. Kelsey, do you have anything to add?
I agree with everything Ruth said. If it was me working in the pharmacy, I agree. I think I would be like really wanting to help. Here's what you can do if you want to help. You can help her take all the labels off of her meds and then send and put them in your PHI bin, and then send her to a drug disposal with all the tablets. But yeah, we can't take back tablets once they've left the pharmacy, so it's unfortunate. But yeah, the best you can do is equip her with the nearest place.
Thank you. That's a good answer. That's a fair answer. Definitely tell her about Drug Take Back Day. Sometimes there's locations that'll take more than just pills, and that might be right for her. And maybe there will be some lovely students that help out with that will take the labels off for her. Because I think we all know that sometimes when you have an elderly individual, they can't always bend their fingers and grasp and take those little labels off. Moving on to the next one. When is the last time that you, as a pharmacy professional, cleaned out your own medication cabinet? Let's start with Ruth.
Sure. Well, first, because a medicine cabinet isn't the best place to store my medicines, that's not where mine are. So the heat and humidity in the bathroom, not the best thing for your medicines. So I actually do have them more in a locked box. And it was just the other day that we needed a Benadryl and found that our supply was expired. So it actually was a great opportunity to look through everything that was in there. So it wasn't so long ago as the case may be. But I do believe the time before it had been several years. I'll just admit to that. So, but it was a good reason and a good prompt when I was looking for something and found it expired to go ahead and clean out everything.
Thank you for sharing that. I, at one point, I think it was during the pandemic, did not clean out my own medicine cabinet for probably 3 years. And I think it was because I just wasn't going a lot of places. The grocery store was pickup, or going to church was online. And then I just skipped all of the drug take back days as well. So I feel you on that. There have been entire years that I've missed myself. Kelsey, anything to add? What do you do? When's the last time you cleaned out your cabinet?
I'm guilty of waiting a while too. I think the last time I was really diligent about it was when my daughter came home. And that was kind of the impetus that, okay, like we need to, and now that she's walking around and can get in things, it's been very important to me with having a young child in the house. And we'll use my husband as an example again, too. He also has type 1 diabetes. So I like to make sure that we have in-date rescue medications if needed and things like that. So there are certain things that kind of trigger me to go and take a look at expiration dates. But as with Ruth, I think I could be better about it.
Hey, that's all right. I think when we show our human side, other people can relate. Yeah.
That's right.
Sometimes it's years for all of us.
The years go fast.
We could learn from one another. Like Ruth said, something may prompt you to use a medication. You look at the expiration date, you realize one thing's expired. Then you think, what else could be expired? That's a good opportunity to go through absolutely everything, or a drug take back day. Brittany, would you like to weigh in on this?
Well, I have to confess, I have a cheat system. My husband and I both have birthdays that occur just a couple weeks before each of the takebacks. So I just use that as a reminder. I know our birthdays are coming up. I think about the fact that we're getting older. We have more things than we used to. And we take that as an opportunity and a reminder. And then they're ready to go for when the take back comes around. But another thing that I would recommend, and I've run into this with my own family, certainly, especially among some of the older adults in my family, I see them wanting to protect resources. And one of those examples as well is around pet medications because of the cost associated with them. And they don't necessarily think about disposing of leftover pet medications because they're thinking of them in a completely different category than human oriented medications. And so that's prompted some conversations as well. It's like, well, when it's time to get out there and do our spring cleaning, let's remember to also look in that other location where you keep some of those things. And, I don't think anyone needs to be perfect. We just try to do a little bit better every year.
Thanks for weighing in. I never thought about assigning a date on the calendar like birthday as a reminder. Yeah. Oh, I don't want any more birthdays. I'm 45. I want them to stop.
I didn't note the number on the calendar, Kim. I just, just the event.
All right. Fair enough. Thank you for sharing, all three of you. And let's talk about drug disposal box locations. I live in Perrysburg, Ohio. I know where my nearest drug take-back boxes are. I have a couple of police stations, the township and the city in Perrysburg, which is where I live. But then I also have a police station across the river in Maumee, Ohio that I can go to too. So I know a few, but not every single pharmacist knows. So I wanted to ask you, where is the nearest one to you? You can say work location or the city where you're at. I don't want to get too personal.
I can start. When I work at Nationwide Children's Hospital, we have one right down in our pharmacies. So that's excellent. When I work at Ohio State, we have a permanent disposal location at our student wellness center, student health center, as well as over in our outpatient pharmacies at the hospital right across the street. So those are both there. And when I'm home, it's at the fire station. That's a couple minutes from my house.
Thank you. You're on top of it. Love it. Ruth, how about you?
Yeah, sure. Mine it happens to be the fire station as well. So I am fortunate to live fairly close. So it's really convenient for me. But if someone else doesn't know, if a pharmacist doesn't know where their location is, FDA.gov is a great site to go to that's going to list. I think I have that right. Kelsey or Brittany can correct me if I've got that website wrong. You can go ahead and put your zip code in and find a location. I tend to, we talked a little bit ago about being at a tabling event and trying to give out good information. That's one thing that I try to give out is just the information that there's a resource available for you to find that box closest to you.
Thank you for sharing that. If you go to fda.gov/drug disposal, there are resources there and there's clickable links. So yeah, you're right. You can go to that website and that's not a bad way to find one. Just go online and find something. And there is no shame. I don't want to shame anybody for not knowing where their drug disposal box is. If you don't know where it is, that's what this quiz is for, to help you to understand a little bit better best practices and give you an opportunity to have that question in mind and find the answer to it before someone else asks you, because you can have a greater impact on yourself and your community when you have the answers ready. Brittany, did you want to weigh in too? Where's your nearest drug disposal box?
We actually have one at the nearby police station, so I'm able to use that one. But working at Ohio State University, we also have some on-campus opportunities that serve our students and our broader community. So I'm fortunate to have multiple options.
Excellent. Glad to hear it. I think you folks in Columbus, Ohio, that Columbus area, you have a lot, like a large volume of opportunities. And I love hearing about that. Where I live, the fire stations do not get involved unless there's, it's 1 in a million. There's not many. It's mostly the police stations, cities, townships. I live kind of in a rural area. So opportunities in a city may be different from opportunities in a more rural setting, like where I am. Last question number 10 on Drug Take Back Day. This has to do with the EpiPens, the creams, the ointments, the inhalers. Where can you get rid of those odd dosage forms that are not pills that can easily be dropped off at a typical drug take back box? Kelsey.
Yeah, this is Kelsey. That's a hard one. You know, I have looked at some websites for particular locations on take back days, and some of them do say that they will take things like patches or liquids or things like that. So I think it's important to start there. For things like inhalers, a lot of places won't take inhalers because they pose kind of a fire risk, and things like that. So, calling actually like your waste management program and seeing how to dispose of them or, and I know that sounds like maybe a hard step to take, but that might be the best way to figure out how to dispose of those particular dosage forms. A lot of things aren't recommended to just go down the sink or anything like that. So, sometimes when I have a patient who has maybe an injectable dosage form, maybe I'm also giving them a sharps container to get rid of like supplies. And then if their take back locations don't take liquids, I can tell them, okay, put the rest of it in your sharps container and then dispose of your sharps container afterward. So sometimes you just kind of have to improvise in the moment depending on the dosage form. But I would say, yeah, checking the take back location and seeing if they list the dosage forms, and then calling the waste management company to see how they would recommend to dispose of some of those other things would be my recommendation.
Thank you for sharing that. Ruth, anything to add?
Yeah, that's going to be very dosage form specific, unfortunately. And it's going to be a little more difficult, I'll just be honest, to try to figure out what the right disposal method is for those different dosage forms. I'll be honest, I'm going to be interested to hear what the DEA has to say and what guidance that they provide.
Me too. I am lucky locally that I have this police department over the river in Maumee, Ohio, that partners with a hospital, and they accept everything: sharps, liquids, creams, eye drops, nasal sprays, all the things. I have been so lucky that I found them. And I tell all my mommy friends, if your kids have some expired EpiPens, today's the day, get rid of them there. And then you don't have to feel the guilt, because they definitely don't want to put them in their their household trash to be taken away to a landfill. They know better. So I at least have some place that I can recommend to them. But yes, for everybody else, I will be interested also to hear what the DEA has to say. I have a phone call with them a little bit later today, so I'll include those responses after this. Brittany, do you know of any place that in your neck of the woods that takes those odd dosage forms, or do you have any suggestions for the pharmacists listening to this?
I don't have much to add from what Kelsey described. Is sometimes we have to be pragmatic in our problem solving and do the best that we can. In my area, I won't mince words. I do sometimes have to rely on those metro locations in proper central Ohio as opposed to where I live every day. In thinking about other accessible ways to get this work done, I am so heartened to hear what you just described, Kim, about the local hospital and the partnership. And I would love to see that scaled and that built on in more communities, particularly in rural communities where, we need accessible everything. We need to be able to get rid of things. We need to use them well. And so I'd be so encouraged to hear from them as well on how they got that project up and what any of us could do to try to promote and advocate for other programs like it.
The program that I'm referring to in Maumee, Ohio, it's a police department that connects with a local hospital. And then they also have students from the University of Toledo helping with that. So it's a drive-through. It's so nice. I literally take my grocery bag, just like that elderly woman that we were talking about. And I drive through and I give my grocery sack to them and I can drive away. But usually what I do is I park and then I take their picture and I introduce myself as a pharmacist and say, I just want to commend you for volunteering and I want to see what you're doing. And then the police officers are always so nice. They hold it in an evidence bay. So it's like a roll up garage type thing. And that's where, they usually keep some bad stuff, but good things happen there on Drug Take Back Day. I'm very fortunate. So I would love to see that everywhere in America. All right. Well, what questions did I not ask that I should have? Brittany, I know that you had some resources you wanted to share. Would you like to share those at this time?
Yes, and thank you for the opportunity to do so. If I could, I'd like to highlight one of our resources and then one of a partner resource. So if you are living here in Ohio, for example, I alluded earlier to those mail-in options where you could request a drug deactivation pouch be mailed to you. So if you are a resident here in the state of Ohio, you can go to OhioRxDisposal.com. And that is a locally state-controlled and supported website, and they are going to give you all the permanent drop-box locations that are here in Ohio. You can look them up. They can register for them as well as take-back sites. It's also where you can go online and just request that one of these drug deactivation pouches be mailed to you. So that's just a great resource, I think, for residents who might not have transport options, accessibility options, whatever. I really want to give credit to them for the work they've been able to do there. And the second thing that we haven't talked about as much today, but I think is such an important piece of just keeping your medications safe, known, and aware. If you are keeping a medication safety record, if you have a list of your actual medications, you know where they are, your significant other knows where they are, that's also a great reminder for yourself when that changes. Oh, then I need to get rid of these other things that are on the list. But I think it's also just an important practice for folks when we are going through their home or there's been an incident or there's something that we need to figure out what we need to know, what medications might be in the home. If you're keeping that medication record for yourself or for those in your family that might need one, I think that's just a really important daily practice that we should all be doing and can be a great reminder for when we need to correctly store and then dispose of things as things change.
Yes, and for emergency planning too. I love that.
Absolutely.
I love a good list anyways, but yeah, you bring up some very good points and thank you. On the topic of drug disposal and the quiz and what you do at Generation RX, Ruth, do you have anything that you'd like to add?
Sure. I would just love to encourage pharmacies, community pharmacies, or whatever pharmacy that you're practicing in, to help spread the word about some of these different disposal options. I think the deactivation pouches are something too that the community doesn't know much about. Pharmacists may or may not yet know about them. And so that's another great resource that we can put in people's hands to make it much more convenient for them to appropriately dispose of their medications.
Thank you for adding that. I know that Drug Take Back Day was quite possibly created to help with diversion of controlled substances, the opioids, the benzodiazepines, the drugs that are most heavily abused. But there are other things that we need to safely dispose of. And Ruth, by talking to people right there at the pharmacy counter, educating them, educating ourselves first, we're only increasing our impact as pharmacists. We need to increase our impact. We can have an impact on not just the opioids, the benzodiazepines, but also just all medications for the safety of our families, for the safety of our pets, for ourselves too. Kelsey, I know that this was very targeted for drug disposal, but is there anything else that you would like to add too about drug disposal, Generation RX? The floor is yours, ma'am.
Yeah, thank you. I think as far as Generation RX goes, when I started as a student, this was very much, it was very much you went out to maybe a school or a program and you gave a presentation and you were kind of a facilitator. But it's really grown, and we're really encouraging pharmacists and other healthcare providers to really incorporate safe medication messaging into their daily practice. So I think as a pharmacist, you might think, oh, I don't have a role to play in this, but you certainly do as the most accessible healthcare provider. I'm sure we've all heard that about pharmacists. There are just so many ways that you're probably already incorporating these messages into your daily work with patients. And I'd really encourage you to get your students and your interns and your technicians to speak the language as well. This isn't just something that we can do. This is something that we can all do. And I think can really make an impact on our patients of all ages.
I love that you keep talking about the students and also the technicians, because I know technicians sometimes listen to this podcast as well. And I definitely know that students listen. If we raise these students to know about safe drug disposal and use practices, I think that we are raising the next generation of pharmacists to know the right messages to use and have the best impact. One thing that I wanted to say as we start to wrap this up is that you guys talk about Generation RX at the annual meeting of the Ohio Pharmacists Association. Do you plan to do that again in 2024? Ruth.
I will say, if we're invited, we would be willing. We're always willing to, anyone who's willing to give us as Generation RX an ability and a good platform to share with health professionals, we're game.
Awesome. Every time I hear you guys talk, I learn something. And you've had breakout activities before and pass the mic opportunities. I love hearing what other people are doing in their various parts of Ohio. Whatever you do next year, hopefully you're invited, but whatever you do, I look forward to hearing about it, whether I attend in person or on demand. That has been so awesome, being able to watch the Ohio Pharmacists Association on-demand sessions, because then I don't have to pick between two live. I know I can catch you guys on the replay, which is great. So thank you all for everything that you do, and thank you for sharing how you use your voice here on the Pharmacists Voice Podcast. Take care. Thanks again to Brittany, Ruth, and Kelsey for sharing your medication safety expertise. I hope to see you at the OPA annual meeting in April of 2024. Thanks again. Now let's get to the DEA's input. Again, I spoke to two representatives. One is a National Take Back Initiative coordinator in Detroit, Michigan, and the other is a community outreach and prevention support program manager in Washington, D.C. I only asked for input on a few questions. They are questions 5, 6, 7, and 10, if you're following along. Question 5 had to do with volunteering at the Addiction Task Force for your county. They have an informational table at a health fair. You, as a pharmacy professional, are manning the table. And since this is a community outreach event, you have the opportunity, since Drug Take Back Day is coming up, to communicate information to the public. What opportunities do you, as a pharmacy professional, have at this table? When I asked the DEA, the Community Outreach Program Manager was very helpful with this question. This is the type of thing that she does in her job. She recommended going to the Partnership Toolbox located at deatakeback.com. And she recommended printing materials for the table. So if you're at a health fair or a community event, you can just hand out materials. She also said there is a great handout about how to properly dispose of your unused medications on this website, getsmartaboutdrugs.com. Once you go to getsmartaboutdrugs.com, go to the top right and click on DEA Publications. There's more than one page of results that will come up, and as they publish this in October of 2023, the handout about drug disposal is on the second page of results. It's available in English and Spanish. I think all of these materials are available in English and Spanish. So again, check out all those materials that you can print out for a health fair or community event on those websites, deatakeback.com and getsmartaboutdrugs.com. In summary, printed materials make great handouts. Familiarizing yourself with the materials prior to the health fair or community outreach event makes you, as a pharmacist, a lot more knowledgeable. So it's highly recommended that you review those materials before you give them out. That does it for question number 5. Thank you, DEA. Now on to question 6. It's about your child who comes home from college with an illicit substance in their hoodie. So they have maybe marijuana or meth or ecstasy in a hoodie pocket. This illicit substance is now in your home. The question is, can you get rid of that illicit substance at a drug take-back event? According to the DEA, the answer is no. I appreciate their direct answers. What's a parent to do, though, if they find illicit substances in their child's clothing? You might be wondering this as well. I was wondering too. According to my source at the DEA, illicit substances such as marijuana or methamphetamine are not part of the Drug Take Back Day initiative and should not be placed in collection containers. If an individual attempts to surrender an illicit controlled substance, law enforcement personnel should handle such material as abandoned property in accordance with department policy. I'm just going to leave it at that because I've got my answer. No illicit drugs in drug take-back boxes. Contact local law enforcement for help. I'll just leave it at that. On to question number 7. Question number 7 talks about the patient who comes to your community practice pharmacy with a bag full of medications. What can you, as a pharmacy professional, do when this person comes to your pharmacy and your pharmacy does not have a drug take-back box? My source at the DEA suggested pointing this patient to a year-round collection site locator online so that she can find the nearest take-back site to her. So putting the responsibility on the patient. The DEA's collection site locator is on dea.gov/takebackday. It will be updated throughout the year, especially in the weeks right before and right after the Take Back Day events. On to question number 10. Question number 10 has to do with dropping off EpiPens, eye drops, nasal sprays, suppositories, patches, anything that's basically not a pill at a drug take-back day event. DEA has a protocol for take-back, and it says participants may dispose of medication in its original container or by removing the medication from its container and disposing of it directly into the disposal box. However, liquid products such as cough syrup must remain sealed in their original container. If an original container is submitted, the individual should be encouraged to remove any identifying information from the prescription label. All solid dosage pharmaceutical products and liquids in consumer containers may be accepted. The depositor should ensure that the cap is tightly sealed to prevent leakage. On this one, this is Kim talking here. On this one, I take that to mean that eye drops, cough syrups, suppositories, patches, etc. will be accepted. I'm still not sure about inhalers. I would check with the site collecting the meds for more information. The DEA also addresses sharps. They say that intravenous solutions, IV bags and so on, injectables and syringes, will not be accepted due to potential hazard posed by blood-borne pathogens. Now, this is Kim talking. Sounds like EpiPens, Lovenox syringes, and so on will not be accepted at your average drug take-back day event. What's helpful about this is that she, the educator, pointed out to me that the EPA has information about safe sharps disposal on their website, and she provided a link, which I'll put in the show notes for episode 249 on the pharmacistvoice.com. I know that was a lot to relay to you from an email, but it was all great information. In summary, the DEA weighed in about community resources, illicit substances, collection site locators, and dosage forms other than solid pills. Thank you, DEA. Now, on to responses from my friends at 3 different poison centers. First of all, thank you to everybody who helped me. Thank you to the Central Ohio Poison Center, Dr. Wendy Stephan at the Florida Poison Information Center in Miami, Florida, and Angel Bivens, RPH, at the Maryland Poison Center. Wendy shared that incorporating drug take-back into the life cycle of all medications is the goal of drug take-back. She likes that there are more drug drop-off locations at retail pharmacies now because that's where people are getting their prescriptions, right? Take-back events are great too. The most immediate hazards of stockpiling drugs in the home are poisonings and diversion or theft. Although the public does care about water contamination, air pollution, and incineration, flushing drugs like buprenorphine, oxycodone, and hydrocodone is still recommended by the FDA to reduce the acute risk of harm to the household. Good points, Wendy. Wendy provided some links on drug disposal that you'll want to check out, so see those in the show notes for episode 249 of the Pharmacist's Voice podcast on thepharmacistvoice.com. Thanks, Wendy. Now on to Angel's comments. Angel shared some general comments too. For example, she said, the sooner we see that something is expired or not being used, it should be removed from the house. Permanent drop-off locations are useful in between DEA take-back days. And Angel agrees with Wendy's comment that educating the public about year-round locations at drug take-back events will help make year-round drug disposal part of their routine and not just a twice-a-year thing. I must say, I agree with that comment. As far as resources go, Angel points out that step-by-step instructions for disposing of medications safely at home and providing the flush list can be helpful resources for everyone that we're educating about drug disposal. Great points. Thank you, Angel, and I am looking forward to teaming up with you, Angel, and Wendy, too, for another poison prevention episode in March of 2024. For the past few years, I have made March Poison Prevention Awareness Month on my podcast. All right, now for the responses from the Central Ohio Poison Center. Question number 1 asks about disposing of 5-FU cream. 5% fluorouracil cream. It's a topical chemotherapy product, and in my own research and my conversation with the Poison Center, we were actually not able to find disposal instructions. The only thing that I did not do to answer this question was call a manufacturer and ask for specific recommendations. I'm not an overachiever, to be honest, so I'm just going to stop there. But please know that if you want the answer, you can contact the medical information department or the drug information department at a drug company that produces fluorouracil cream and ask a question like that. If I had time, I would have researched it myself. As you can tell, I went into a lot of detail to create this episode, so I'm just going to stop there. We talked about the research process. Call that drug manufacturer. I did not ask the Central Ohio Poison Center all the other questions on the drug disposal quiz, just that first one. However, I will say on their behalf that The poison helpline, 1-800-222-1222, should be in your phone. And if you are out there educating the public about medication safety, they have educational materials available. Magnets with the poison helpline on it, brochures, and so on. Call your poison center today if you would like some of those materials. The number again is 1-800-222-1222. I think that about does it for this episode, and my voice is toast. I have had some weather changes up here in Northwest Ohio, from cold to warm and warm back down to cold tomorrow. So I am just struggling to talk. So I will just say about the only thing that I didn't dive into was sharps disposal. And I know that EpiPens do expire and people discontinue Lovenox injections. So they are stuck with these sharps at home. They have pre-filled syringes in their house unused, so it's not something you would just typically put into a sharps container. So I don't have any concrete solutions for you there. But I will say that if you're lucky like me and you have an awesome drug take back event near you that takes everything, even expired EpiPens, don't miss your drug take back day chance. Get over there and get rid of that stuff. Tell all of your patients to get rid of their stuff on drug take back day. I think we all know that many people throw out their unwanted, no longer needed drugs straight into the trash. As pharmacy professionals, we hate to see that. And we know there are alternatives, which we can communicate to our patients and keep them safe, their pets, keep our air, water, and communities safe. So now that you know more about drug disposal, please use what you know to keep yourself, your patients, your families, your pets, the air, the water, and your communities safe. Thank you for listening to episode 249 of the Pharmacist's Voice podcast. Please visit thepharmacistvoice.com to read the show notes. In the show notes, you'll find the links to the Generation RX program, Drug Take Back Day, America's Poison Centers, and the videos mentioned by my many sources for this episode. If you know a pharmacy professional who needs to learn more about drug disposal, please share this episode with them. And if you like this podcast, please subscribe to or follow the Pharmacist's Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. I'll be back next Friday, November 3rd, with a new drug name pronunciation episode. Those are my most popular episodes, and I love them. Hope to have you with me next Friday. Thanks again for listening today. Have a safe weekend.